Every morning, Linda would lie still in bed, afraid to move. The moment her feet touched the floor, a sharp jolt of pain would shoot through her lower back like lightning. She felt trapped in her own body, stiff, sore, and exhausted before the day even began. She used to think, maybe this is just what getting older feels like. Maybe I am just stuck with this pain forever. But what if I told you that Linda did not need surgery, or endless prescription medications, or costly medical procedures? Linda found real relief through simple science-backed changes right in her own home. And the best part, you can too. Here is a fact that might shock you. According to Harvard Medical School, over 65% of adults over 60 suffer from chronic back pain. But here is what most doctors will not tell you. The majority of these cases can improve significantly without invasive treatments. Welcome to Senior Health Facts, your trusted source for health wisdom designed specifically for adults over 60. If living healthier, stronger, and with less pain matters to you, go ahead and hit that subscribe button. We are here to guide you on this journey. Back pain is not just a minor inconvenience. It is a life thief. It steals your energy, your independence, and your ability to enjoy the simple pleasures that make life worth living. Things like playing with grandchildren, taking evening walks with your spouse, or simply getting through your daily routine without wincing. According to the National Institute on Aging, up to 85% of people will experience significant back pain at some point in their lives. And for adults over 60, that risk increases dramatically each year. But why does this happen to so many of us as we age? As we grow older, several natural changes occur in our bodies. Our muscle mass naturally declines, especially those critical core muscles that act like a natural corset supporting your spine. Our bone density decreases, making the vertebrae more vulnerable to stress. The discs between our vertebrae lose water content and flexibility, becoming less effective shock absorbers. And years of accumulated habits, poor posture, improper lifting, sedentary lifestyle finally catch up with us. Think of your spine like a house that has weathered many storms. The foundation may have shifted slightly. The supporting beams might show wear. And without proper maintenance and care, small problems can become major structural issues. But here is the encouraging news that Linda discovered, and that gives hope to millions of seniors. Your body still has a remarkable capacity to heal, strengthen, and recover. With the right approach, the right movements, and the right mindset, you can rebuild strength and significantly reduce pain. Linda's path to healing did not start with what she added to her routine. It began with recognizing and stopping 7 critical mistakes she had been making for years. These are the same mistakes that keep millions of seniors trapped in a cycle of chronic pain. The first mistake was complete rest and avoiding movement. This might sound backwards, but Linda used to think that lying down all day would help her back heal. The truth is, prolonged inactivity actually weakens the very muscles your spine needs for support. A comprehensive study published by the Mayo Clinic found that bed rest for more than a day or two can actually delay recovery and increase stiffness. Linda used to spend entire afternoons on her recliner, but she learned that gentle, consistent movement was actually medicine for her back. The second mistake was ignoring posture throughout the day. Whether it was slouching in her favorite chair while reading or hunching over her tablet to see family photos, Linda's posture habits were silently damaging her spine. Poor posture adds tremendous pressure on spinal discs. Imagine stacking books unevenly on a shelf. Eventually, something has to give. Each hour of poor posture was like making small deposits in a pain bank that would come due later. The third mistake was neglecting core muscle strength. Linda never realized that her abdominal muscles and lower back muscles work together like a natural brace for her spine. Without this internal support system, every movement puts extra strain on the vertebrae and discs. The good news is that you do not need intense gym workouts. Linda learned simple exercises she could do right from her kitchen chair. The fourth mistake was over-relying on pain medications as the only solution. Linda used to take over-the-counter pain relievers almost daily, thinking they were helping her heal. But medications only mask the pain signal. They do not address the underlying cause. Long-term use of NSAIDs like ibuprofen can lead to stomach problems, kidney issues, and even increased fall risk in seniors. Linda now uses them occasionally as a backup, not as her primary strategy. The fifth mistake was using improper body mechanics for daily tasks. Every time Linda bent at the waist to pick up laundry groceries or her newspaper, she was putting enormous strain on her lower spine. She had no idea that this simple movement error was contributing to her daily pain. Learning proper lifting technique, bending her knees, and using her leg muscles was a game changer. The sixth mistake was carrying extra weight without understanding the impact. Linda did not realize that even 10 extra pounds can add up to 40 pounds of additional pressure on her lower back joints. When she lost 15 pounds over 6 months through gentle diet changes, the relief in her back was noticeable within weeks. The seventh mistake was sleeping in positions that stressed her spine. Her old sagging mattress and sleeping on her stomach were setting her up for morning stiffness and pain. Linda learned that her sleeping position and support system affected how she felt for the entire next day. Have you been making any of these same mistakes? If so, do not worry. Recognizing them is the first step toward feeling better. Comment learning below if any of these sound familiar. You are definitely not alone in this journey. Relief came to Linda not through one dramatic change, but through a series of small, consistent improvements that built upon each other. Here is exactly what worked for her and what research shows can work for you too. The first solution was establishing a gentle daily movement routine. Linda began each morning with 5 minutes of gentle stretches, targeting her hips, hamstrings, and lower back. Nothing fancy or strenuous, just slow, mindful movements that told her body we are ready to move today. Research published in the Journal of Geriatric Physical Therapy shows that consistent, gentle stretching improves flexibility and reduces morning stiffness by up to 40% in adults over 65. The second solution was implementing the 2 short walks strategy. Instead of trying to exercise intensely once in a while, Linda adopted 2 15-minute walks each day. One mid-morning and one after dinner. According to a 2023 study in the American Journal of Physical Medicine, this approach improves circulation to spinal tissues, reduces inflammation, and maintains joint mobility more effectively than sporadic, longer exercises. The third solution was mastering chair-based core strengthening. Linda discovered she could strengthen her core muscles while watching her evening television programs. Simple movements like seated marches, gentle pelvic tilts, and modified crunches helped her rebuild the internal support her spine needed. After just 4 weeks of consistency, she noticed improved posture and confidence in her daily activities. The fourth solution was transforming her home environment for spine health. Small changes made a big difference. Linda added lumbar support to her favorite chair, elevated her feet slightly while sitting, and started using a heating pad for 15 minutes after her evening walk. These modifications reduced daily strain and promoted healing. The fifth solution was joining a senior-appropriate movement class. Linda found a chair yoga class at her local senior center. The slow, controlled movements helped both her body and her mind. Within 3 months, she felt more flexible, more balanced, and more connected to other people on similar health journeys. The social aspect turned out to be just as healing as the physical movements. The sixth solution was adopting anti-inflammatory eating patterns. Linda did not go on a strict diet. She made smart swaps. She added more colorful vegetables, omega-3 rich fish like salmon, and anti-inflammatory spices like turmeric to her regular meals. She reduced processed foods, excess sugar, and fried foods that can increase inflammation throughout the body. A Harvard study shows that dietary changes can reduce systemic inflammation by up to 25% in older adults. The seventh solution was prioritizing spine-friendly sleep habits. Linda invested in proper pillow support and learned to sleep on her side with a small pillow between her knees. This simple change kept her spine aligned throughout the night, leading to less morning stiffness and better overall sleep quality. Your simple daily action plan includes starting each day with 5 minutes of gentle stretching. Take 2 15-minute walks, morning and evening. Practice 3 simple core exercises during television time. Add 1 anti-inflammatory food to each meal. Sleep with proper pillow support. And stay hydrated throughout the day. Want to start small? Choose just one of these strategies to try tomorrow morning and share in the comments how you feel after 1 week of consistency. Let me share one more story that might touch your heart. Dorothy was 74 when she first felt that familiar ache creeping into her lower back. At first, she brushed it off. Just part of getting older, she told herself. But then one morning she bent down to pick up her newspaper and could not straighten back up without grabbing onto her porch railing for support. That moment terrified her. She thought, is this the beginning of the end of my independence? Will I need help with everything now? But instead of accepting defeat, Dorothy made herself a promise. I will try one small thing each day to get stronger. She started with something so simple it seemed almost silly. She put a pillow between her knees at bedtime. Then she added 5 minutes of gentle stretching each morning. Next, she began taking short walks around her neighborhood. Step by small step, day by day, Dorothy began to reclaim her strength. 18 months later, Dorothy completed a 5K charity walk with her daughter, pain-free and proud. If you have ever felt like your body is working against you or worried that your best days are behind you, I want you to know that you are not alone. But more importantly, I want you to know that you still have power. You can still make changes that matter. You deserve to feel strong and confident in your own body. So here is my challenge for you. Start tonight. Choose one small action from what we have discussed. Maybe it is adjusting your pillow. Maybe it is doing 3 gentle stretches. Maybe it is drinking an extra glass of water. Whatever resonates with you, just begin. And if you are ready to continue learning about healthy aging and taking control of your well-being, hit that subscribe button right now. We are here to support you every step of the way on this journey to feeling your best after 60. Let me address the questions we hear most often from viewers who are dealing with back pain. Many people ask whether it is really safe for someone over 60 to exercise with back pain. When done properly and gradually, gentle exercise is not only safe, it is essential for recovery. The key is starting slowly and listening to your body. Walking, gentle stretching, and chair-based movements are generally safe for most people. However, if you have severe pain, numbness, or tingling, consult your healthcare provider before starting any exercise program. People also wonder, what is the best sleeping position for back pain relief? For most people, sleeping on your side with a pillow between your knees helps maintain proper spine alignment. If you prefer sleeping on your back, place a small pillow under your knees. Try to avoid stomach sleeping as it can strain your neck and lower back. The key is keeping your spine in a neutral position throughout the night. Another common question is, how long should I expect before noticing improvement? Most people notice some improvement in comfort and mobility within 2 to 3 weeks of consistent effort. However, significant lasting changes typically take 2 to 3 months of regular practice. Remember, if your pain developed over years, it is reasonable to expect that healing will take time too. Patience and consistency are your best allies. People want to know about warning signs that mean they should see a doctor immediately. Yes, seek medical attention if you experience severe pain after a fall or injury. Pain with numbness or tingling in your legs, weakness in your legs, or loss of bladder or bowel control. These could indicate serious conditions that need immediate professional care. Finally, many wonder whether diet can really make a difference in back pain. Research suggests that chronic inflammation contributes to pain throughout the body, including back pain. Foods rich in omega-3 fatty acids, antioxidants, and anti-inflammatory compounds may help reduce overall inflammation. While diet alone will not cure back pain, it can be a valuable part of a comprehensive approach. Here is your quick reference guide. Save this to your phone or print it out. Instead of extended bed rest, try gentle daily walks which maintain muscle strength and flexibility, helping you feel more mobile and less stiff. Rather than poor posture habits, practice conscious spine alignment, which reduces disc pressure and causes less daily strain. Stop ignoring core strength and start chair-based exercises which stabilize and support your spine, leading to more confident movement. Move away from medication dependency toward a multimodal approach which addresses root causes, safely providing sustainable long-term relief. Avoid improper lifting and use knee bending technique which protects your lower back from injury, making daily activities safer. Replace inadequate sleep support with proper pillow positioning which maintains spine alignment at night, giving you better morning comfort. Eliminate inflammatory foods and choose anti-inflammatory options, which reduce systemic inflammation and decrease overall body discomfort. Your daily back health routine, designed for adults 60 and older, starts each morning with 5 minutes of gentle stretching beside your bed. Try slow neck rolls, gentle knee to chest pulls, and easy spinal twists. Drink a full glass of water before your morning coffee to help hydrate spinal discs overnight. At midday, take a 15-minute walk after lunch, focusing on good posture and steady breathing. Include anti-inflammatory foods like berries, leafy greens, or fatty fish in your meal. In the evening, practice 3 to 5 simple core strengthening moves while watching television, like seated marches, pelvic tilts, or gentle trunk rotations. End with 10 minutes of relaxation using a heating pad on low. As a bonus weekly habit, join a senior-friendly movement class like chair yoga, tai chi, or water aerobics. The social sigh. Connection is as beneficial as the physical movement. Save this summary and share it with someone you care about. Small changes practiced consistently can lead to remarkable improvements in how you feel every day. The advice we share is grounded in peer-reviewed research and guidance from respected medical institutions. The National Institute on Aging explains how age-related changes affect spinal health and outlines evidence-based approaches to pain management that do not rely primarily on medications. Harvard Medical School researchers detail how regular walking improves disc nutrition, maintains spinal flexibility, and reduces chronic pain in older adults. Mayo Clinic clinical reviews demonstrate that structured gentle exercise programs are more effective than passive treatments for long-term back pain relief in seniors. Research shows that combining movement, sleep hygiene, nutrition, and stress management produces better outcomes than single intervention approaches. These evidence-based guidelines emphasize the importance of staying active and provide specific recommendations for safe exercise progression in adults over 60. Remember, research provides the foundation, but your individual experience and medical history are unique. These findings represent general trends and should complement, not replace, personalized medical guidance. Before we conclude, I want to share something important with you. Everything we have discussed today is intended for educational purposes, only to help you make informed decisions about your health and well-being. The stories and strategies we have shared, including Linda's and Dorothy's experiences, represent individual journeys and should not be considered medical advice. We strongly encourage you to consult with your doctor, physical therapist, or healthcare provider before making significant changes to your exercise routine, diet, or pain management approach. They understand your personal medical history, current medications, and individual risk factors in ways that no general advice can address. What worked beautifully for Linda or Dorothy may need modifications to work safely and effectively for you. Your healthcare team are your partners in this journey toward better health. They are there to guide you in making choices that are right for your specific situation. Every person's body is different. Every person's pain has unique factors. And every person deserves personalized care that takes their whole health picture into account. Be patient with yourself. Be consistent with healthy habits. And always prioritize safety as you work toward feeling stronger and more comfortable in your body. Take good care of yourself, and I will see you in our next video, where we will continue supporting your journey toward healthy, confident aging.